I'm the last one, I think, in this session. Thank you very much. I'm ICU nurse working in Hadassah Hospital, partially in the neurology department and mostly in the nursing school as instructor, clinical instructor, and I'm leading, the teaching of bioethics and law in the. Okay. I'm choosing to deal with the end of life, excessive and persistent treatment, and to ask the question, who takes the decision? You see the picture in the left side. It was taken here in the seashore nearby, and this is a wild lily. And I liked it very much because you can see the dryness and the bloom and the dialogue between both. So I'll start the background with a case study, and it's real case, a real story or a real case from the neurology department. A 100-year-old female was admitted to the neurology department in coma, diagnosed with haemorrhagic CVA. The lady had 7 children and about more than 40 grandchildren. Her kidneys were not functioning and her vital signs were unstable. Her family insisted to perform all treatment, include CPR, if she should deteriorate. Physician gave instructions for code blue and full resuscitation. The reason was fear of litigation. The law also provides, I think that I made, never mind. The law also provides a framework for medical system whether to refrain from prolonging life or to refrain from giving excessive, persistent treatment in situations defined by the law and in accordance with the rule set out therein. We came across the dilemma also in much younger patients and in many medical setups dealing with end-of-life situation. Why? The aim of this presentation is to create a new structured framework to help the medical team to apply adapted and suitable treatment for a specific patient to his or her benefit and in their best interest. Background 2. The intention of the law of the terminally ill patient in Israel was to regulate the medical treatment of a dying patient while balancing the value of the sanctity of life with the autonomy of the assumed will of the patient and the importance of the patient's quality of life. We would like to suggest guidelines in bioethics that will allow for dealing with situations of excessive, unnecessary treatment in order to prevent harming the patient's dignity towards life's end. Rationale. Today, the approach is in most health institutions in Israel is ambiguous. There is no uniformity in the overall decision-making process in determining policy, understanding, and quality or value of life, and the role of the family in this matter. Recommendations. Establishing and implementing an educational program for the medical staff, doctors and nurses, that will include recognizing the need to decide about applying full resuscitation of the patient with dismal prognosis. I put here a note that I use the term dismal versus futile because futile is not the right term to describe those conditions, because it's a bit unclear, or we think that it's a term that need more, maybe it's judgmental term, and usually in the literature and in this population we don't use futile conditions. It's more sensitive, empathy, and some integrative capabilities of data integration. That's what we think. Though considering ETPT may be legal, it may be ethically unjustified, as well as contain elements of defensive medicine that may violate the basic law of human dignity in life and death. This may bring medical teams to actually perform full CPR in patients whose medical prognosis is known to be dismal. The proposed program will include 4 strategies. The first one is understanding the principles of the patient's autonomy based on the understanding that a patient's right impose both duty and responsibility on the caregivers. The second one is coping with the difficulty of accepting failure of therapy, understanding that the tools available to the treating staff are limited. The third one is identifying the main point of the law and the protection it provides to both the patient and the staff. And the last one, creating an institutional infrastructure for staff with appropriate training to mediate between the patient's assumed will and the caregivers. Finally, it is impossible to reach a universal and agreed upon situation to all the medical problems associated with ETPT at the end of life. And the moral dilemmas in this matter are many and complex. But caregivers should receive a structured program guidelines to maintain the dignity of the patient during life as well as death. Thank you.